Good afternoon, everyone, and welcome to our webinar this afternoon. I'm Sandra Whitehead. It's my privilege to be the current leader of SOPHIA, the community of HIA professionals. We are so happy that you have joined us this afternoon. If you're not a member of SOPHIA already and you enjoy this webinar, I encourage you to go to hiasociety.org and join SOPHIA so that you can learn about our future events, including our practitioner workshop, which will be occurring in Arlington, Virginia in the spring. So thank you all for joining us. It's my pleasure today to introduce Dr. Delia Somerville. And Delia is going to share some of her research, her recent research with us that contributed to her recent publication. And it's a review of the use and effectiveness of HIA in the oil and gas sector. HIA is used quite differently in the private sector, and Delia has a deep and rich background working in the private sector in this industry and doing HIA. So we're really excited that about what she's got to share with us today, based on both her deep experience and her recent research. Welcome, Delia. We're so glad to have you.
Thank you, Dr. Whitehead. Can you hear me okay?
We can, thanks. Go ahead.
Yeah, thank you for having me today and for the opportunity to present. Also, thank you for everybody who is online. It's a busy holiday season, so happy holidays to everybody. I am gonna move my slides. Hopefully that works. Yes. So today, I wanted to talk about the health impacts of energy industry. Also, I don't think I need to tell you about HIA, but I would like to talk about HIA in the context of the energy industry and specifically private companies, which may or may not be different or may not sound different to you. Um, I will also share some of background and some of the steps I took when I did my research. Um, I will also share findings and recommendations and also potential implications for practice. We will have time for Q&A at the end, and I think Oma is going to keep me on track with time. But if you have some questions during the session, I think that's okay. As long as Dr. Whitehead is happy with it, we can stop and take questions at any time. We are a small group. As Dr. Whitehead had mentioned, this work was part of my doctorate dissertation at Johns Hopkins University, Bloomberg School of Public Health. It's part of DRPH program. So I wanted to start with this three relatively recent stories that have been on the news. So the first one, I think it's 2020, so it's relatively recently. It's a story from Ecuador where Baorani indigenous people filed a lawsuit against a Chinese state company. And the lawsuit was about impact on the health and quality of life of indigenous peoples and related to flaring and climate change in Ecuador. The second story is it's more recent and from earlier this year. It's the first time, actually the next two stories, it's the first time that international companies, international oil and gas companies were sued for health impacts in developing countries. But the lawsuits were in England and in the Netherlands. So that's for the first time that happened. So the second story is Shell, and it relates to oil failure to clean oil spills over the years in Nigeria. And that's again local communities bringing this lawsuit against Shell at the High Court in London. And then the third one, it's again the first time that BP, International Oil and Gas Company, uh, was presented with a claim, with a lawsuit by Iraqi father for the death of his son. And it relates to the air pollution in Rumalia area of Iraq. In fact, the town that the father and the son are from is called Cemetery, just because of the number of cancer cases in that area. So you may have seen that in the news. Um, so as we know, it is estimated that social, economic, and environmental determinants of health account for 80% of health outcomes. And I think it highlights really the powerful influence that the companies, like the ones we just looked at and others, have on health by shaping the physical, social, and cultural environments in which people are born, grow, work, live, and age. This influence comes from combination of business activities and also more broader societal engagements, including things even like lobbying and advocacy, etc. You must be familiar with the term commercial determinant of health, which refers specifically to the private sector activities that impact health directly or indirectly, positively or negatively. So the companies, private companies, they have numerous opportunities to help with development of sustainable development goals. And in fact, this chart, if you can see it, specifically mentions two SDG Sustainable Development Goals. It's access to energy and also health and well-being. Um, as I mentioned, there are direct and indirect impacts. Some of the direct impacts might be related to injuries and illnesses, whether it's workers or communities, but some of them might be indirect. As an example, a large influx of workers in some area will bring additional strain on the resources in that community. It could also affect prevalence and incidence of infectious diseases, including sexually transmitted diseases or other infectious diseases. Um, Also, there is a concept within the oil and gas industry, there is a concept of just transition where we are moving away from oil and gas to cleaner and greener energy sources, but do it in a certain way that we leave nobody behind. So everybody benefits from it and nobody is adversely affected. Again, whether it's communities or workers. So again, why? Why HIE in the oil and gas industry? And again, specifically private sector. So it is known that companies have business case to use health impact assessment for maintaining their reputation or improving their reputation with the communities and stakeholders. um, it is also used as part of the so-called license to operate or social license to operate, which essentially means it's approval, acceptance of the local communities and stakeholders for that specific project or operations to go ahead or to continue uh, being carried out. It's also a good tool for risk management for oil and gas companies, for energy companies, um, as well as it does have a role in the corporate social responsibility, which is really the activities, initiatives that company are doing that are over and above what's legally required. HIA, again, within the oil and gas industry, can be applied, as you can see on that chart, it can be applied across the full life cycle of a given project, from licensing, from exploration to the actual shutdown of that facility. An issue again in the oil and gas, which is not new, there are not many publicly available reports, so it's really difficult to understand what actually takes place in this area. We know HIA has its place, but there is not enough evidence. Um, in terms of the landscape, you can see here again, it's a little bit difficult to see, but in the 2000s, that's where the first industry guidance was published. It's and I'm going to talk a little bit more about it. So, what are the drivers for the oil and gas companies when it comes to HIA? Well, of course, it's the legal requirements, uh, but we know there are not too many that specifically require health impact assessment. It could also be international funding requirements, IFCs and uh, has IFC's requirements have specific reference to HIA. So that might be required for some companies who seek additional funding from those international institutions. And then an important place here is industries itself has best practice and also internal requirements businesses may have. And since the 2000s, I mentioned the IUGP-IPCA guidelines that has specifically defined HIA for oil and gas companies, for energy companies. As you can see, that definition is pretty similar to any other HIA definitions. I think what would be worth highlighting here is that it mentions decision-making process and the role of HIA. And it also defines the 6 steps of HIA. So it's very similar in its nature. Again, I keep mentioning IOGP IPCA, so I'll explain just a little bit here. So this is the industry association. In fact, it's 2 industry associations, and they've been around for a while. IPCA, that's on the left, it's been around for 50 years, and I would say it's more environmentally focused. But the IOGP and IPCA, they have a joint health subcommittee. And that's the committee that I had an opportunity to work with. So I really had a unique research opportunity to look into how things work in those companies. Again, going back to the same guidance that I mentioned already, it has been around since the 2000s, but it has been updated a couple of times. So it's still a working document that describes best practice for oil and gas industry. This industry association's health committee, they also do annual benchmarking where they look at health management indicators, and they are listed here as elements. You can see them. And every year it's self-reporting by companies, but there is a certain criteria. It's quite complex and interesting, the process. But every year, health impact assessment is pretty low. It's the lowest out of all the indicators. And it's not very clear what barriers are there, why it is low. And then again, as I mentioned already, HIAs are generally not shared, so it's hard kind of to see what the issue is. Now back to my research. So as you can see, my overall goal, given the unique opportunity that I had, was to advance the state of knowledge of practice in the oil and gas industry in the context of current environmental and public health challenges. And then I wanted to see what the difference was between different companies, as well as talk about effectiveness, how it is defined, what it means, and also how we can illustrate when it's effective and or ineffective. And then my hypothetical proposition was really around I believe that there are different approaches by HIA, by different companies, to HIA by different companies, and also that HIA is largely ineffective in influencing projects business decision making, and also that standalone are less effective than integrated impact assessments, as well as monitoring and evaluation is insufficient in most HIAs, which is probably not surprising to anybody. As far as the research approach, this is really like the framework and the framework that I used around context, process, and impact. It's comes from original framework by Dr. Harris Rojas. I adopted it, and maybe just a couple of things to highlight here would be. I wanted to look at types of HIA as part of the context rather than process, and how important it was for the companies. And then also we did look at, in terms of context, questions of climate change and equity, how companies were approaching that. So there were two phases to the process, to this research process. So it started with a survey that went out to the distribution list. And then the companies, and then we also followed up with a sense-making discussion with the actual committee when we had the results. And then phase two was really to select cases. So we had the three cases that agreed to participate. And I conducted semi-structured interviews and reviewed documents that were provided to me in confidential matter, or all the information that is in public domain. This is just the steps to demonstrate how the case studies were built, and I'm going to share with you the highlights from the three case studies. And unfortunately, the take-up of the survey was not great. But on the positive side, I was still able to use my case selection criteria and follow the steps as I originally designed. So starting with company A, it's anonymous. So it may look familiar, but we're not disclosing the names of the companies. So this company is a global energy company, one of the super majors, and that has a very comprehensive health impact process that is also part of the internal project management. So you can see this uh, image that describes it a little bit. They do use both standalone HIAs and also integrated HIAs. However, they're moving towards the integrated more recently. I thought that what interesting was, and I wanted to share it with you. So this is a screenshot of the sustainability report. So this is sustainability reporting is something that companies do every year. And interestingly, they actually report on HIAs every year. So that's part of the key performance indicators for external reporting. This is the next company, again, another global energy company, another large company, super major, that does use HIA mainly standalone and mainly using external consultants. What I wanted to share with you here, which was interesting and a really good example of a comprehensive screening process and how health is looked at during the screening process. So you can see community health is a screening indicator, and there are some parameters there. However, while the screenings are usually very comprehensive, and I include a quote here from the key informant, one of the key informants, the, they usually comprehensive the project screenings, but and quite often health professionals would be part of it. However, what happens after, it's not very clear. And it's not always that it results in an HIA. what more often happens that HIA will be performed just based on a specific request, on some very specific business risk, or something that happened potentially in the region that made the business decide to do an HIA, that it would be a good idea. So it's not really, it doesn't basically fall through the cracks. Quite often, that screening process does not lead to specific actions and ends up being a tick box exercise, so to speak. The next company is again another large company that has it fully integrated. So health impact assessment is fully integrated in ISHA, environmental, social, and health impact assessment. And this is just an example. Again, it's a real document how health is part of the scope of ISHA. And then again, another quote from a person who actually has a specific role, and that role is to ensure that health impact assessment, when it's integrated in ISHA, is performed to the appropriate standard as defined by the company. Now I wanted to share some of the results, or some of the findings rather. So if you don't mind, I'll go kind of by the framework elements. So I'll start with the context. So what was different across those cases was the actual HIA requirements. So it went from quite strong, where the health impacts were a requirement, assessment of health impacts was a requirement for all projects meeting certain criteria, to a more of a like ad hoc approach, like I mentioned, if it's really triggered by a specific need or specific risk or specific incident. And also generally like lack of enforcement, basically, even if it was written down. The type of HIA, it was kind of from integrated, combination of integrated and standalone. So companies were using all the options. What was constant, and as you noticed, all the companies that formed the case studies, they were large companies. They all originated in Europe, and they were all super major. Again, they were large companies with resources. They all had company-specific guidance and also used industry best practice. They also not addressing health as human rights, equity, or climate change issue in HIA. Not to say they're not addressing those issues, but they're not addressing them in HIA. Moving on to the next framework element, process. So what was different depending on the company was collaboration across the disciplines. In some it was strong, in some it was more of a silo health, which is again not unusual, but that's so we had different examples how it worked. But what was constant with them, that health was not taken as seriously during the screening process. It was always, even when there was a process, it was always quite a big job for health professionals to make sure they were at the table during screening process. And also they were, it was more difficult to when it came to scoring and making recommendations for HIA than environmental and social. And that was across all the companies. They all had in-house HIA subject matter expert or outsourced expert, but there was access to expertise. Then also training and competencies were developed for all the companies. And also everybody, even though those were big companies, everybody reported that it was there were quite costs for HIA were quite high. So and that was an issue even for the large companies. The question that was asked also if there was a difference between developed and developing countries, but all the companies confirmed that the process is the same when it comes to health impacts for developed and developing countries. And everybody, again, was consistent that they would only disclose anything when it comes to HIA when it's legally required. If there was no requirement, not surprisingly, it's not shared. Um, and then moving on to the impact, there's 2 points here to make. What was different for these companies was the extent to which HIA supported sustainable development and how it was used as part of sustainability goals and objectives for each company. And what was the same was that monitoring and evaluation was always challenging in all HIAs. No, again, no matter how it worked and what type of HIAs they used, monitoring and evaluation was always an issue. So moving on to the sort of conclusion, we can say that HIA does remain a good tool, a best practice tool for evaluating health impacts in the energy sector. However, its effectiveness is often complicated by inconsistent enforcement and also integration with broader impact assessment. Also, the self-regulating for larger companies might be easy, but with the lack of regulatory frameworks, HIA will not be moving moving forward really. So regulatory frameworks are really important. So in especially again for the smaller companies with no resources to self-regulate. The other so the most critical factors that I identified during this are included in this updated framework. And perhaps one thing to highlight here would be collaboration across the industry. That's important. Again, I already mentioned larger companies have more resources, they have the processes, and if we have industry best practice, I think more collaboration is needed across all the companies to move it forward. And you can see again the updated framework on the slide with the most critical items. So going back to effectiveness for a minute, like I said, I wanted to look at what it means in the context of all these companies that as part of the industry association. So it was confirmed that HIA is its effectiveness is really in how it helps to manage risks and also how it provides basis for community health management plans to address those risks, which could be different from I think other examples of effectiveness. I think the attributes that were reported or confirmed were timing and timeliness of HIA, the quality of HIA team, and also leadership support. And then what was in a way of HIAs being effective was lack of stakeholder engagement, again, inappropriate timing, and also lack of follow-up on recommendations. That was often reported because there's a difference between who performs HIA, who is involved in deciding, and who is actually implementing those health management plans. There's a often disconnect between the two. And then on the image, you can just see like some of the companies provided the definition as well or they didn't have a definition, but they described it in a way. So just looking at the goal and objectives, so if we go back to the hypothetical proposition, I think most of it was confirmed in terms of effectiveness and the standalone versus integrated, as well as monitoring and evaluation. I think the one that is kind of it's the different approaches by different companies. I think yes, they're different, but also there are a lot of similarities. And also there were a lot of similarities between the companies that I built case studies around because they really shared a lot of characteristics. There were some findings and recommendations specifically for the energy industry. Um, and I'm just going to list them here quickly. So engagement of private companies, more collaboration is needed for the health committee. More transparency is needed, which is difficult, but it's not impossible. I think there are ways for the companies to create channels to share insights from HIA and also to share the real examples from HIAs with each other or externally. There are ways to do it in a way that does not disclose perhaps the companies or does not create potential issues. Um, Again, we talked about self-regulation already. Um, I think the in the future, the KPIs should definitely be further developed to see what difference HIA brings and what are examples of success, challenges, rather than measuring it the same way and year after year for more than 10 years saying that it's consistently scoring low. So you can actually understand what's working and what's not working. Um, this concept inside versus outside the fence that is very often used within oil and gas companies, energy companies. And if you can see this on this image, um, really like HIA is looking at issues outside the fence. And quite often, and then you have occupational health programs that looking only inside the fence. They are not looking at communities, some of the industrial hygiene programs, etc. Um, but there are some issues at the fence line that is really invisible fence line. In many cases, there is not really a fence line when it comes to health impacts and health issues that are getting overlooked. So they're not looked properly or appropriately as part of HIA or other tools for community health, and they're not also advocately addressed on the other side within occupational health. And quite frankly, in many areas, your community is your workers. So yeah, it's really invisible fence line. Um, and then what I was also suggesting, it was a more public health approach to integrate those occupational and community health issues to address those fence lines issues better. And this is just an example of going from impact to partners and some of the examples how it can be done. Um, Talked a little bit about corporate social responsibility. There's an interesting conflict when it comes to corporate social responsibility. Most companies do not consider HIA or assessment of health impact assessment as CSR, as corporate social responsibility. Uh, but at the same time, it is something that companies are doing over and above the legal requirements. But I think there is just this, because it's health impacts, I think there is a nervousness to um, associated, I think, with just the actual name of it, health impact assessment. So, but there's really opportunities to use HIA as a tool when it comes to CSR, when it comes to identifying social investments or areas that need support from the private companies. Not just oil and gas, it could be applied potentially to really any industries, and HIA has a role for that. But I think at least in the oil and gas, from what I've seen, there is really nervousness to be using that. Again, role in sustainability, how HIA could support contribution of the companies into sustainable development goals. Again, HIA has definitely a role in it. and then also cooperation between public and private sector. Um, if there are ways to create that forum, but there is really not so much happening, I think, in this space. I think the public and private do not often get together and communicate about health impact assessments. And there is a role, of course, of the finance institutes as well there. And then I mentioned energy transition before. I think there's a need, it's a recognized need that HIA needs to be adapted. There are examples for changing technologies, and specifically IPCA, UGP published Health in the Energy Transition. And I think HIA mentioned there as a tool, but it hasn't been looked in details how HIA needs to be adapted. And then strengthening monitoring and evaluation, there is more work that needs to be done there. So with those findings, I think the question that I asked myself was, are there the implications for the private sector? So as we know, there are not too many examples other than from Australia of the use of HIA in the context of private sectors. So in Australia, I think it was McDonald's and a brewing company, but it was really again it's just a couple of very small examples. So as part of the work on the HIA handbook that Dr. Whitehead was and is part of as well, that will be published next year, but by the as part of the work of International Impact Assessment Association, we created a chapter. I worked with a colleague of mine from the industry on sort of best practice for HIA in the private sector. We hope to expand it to go beyond energy sector, but then we went back to energy sector. So the handbook chapter is still on the energy sector as a best practice, but we were hoping that it could be used outside as well. It's just simply because there was not enough evidence to go with to write this chapter. Just really quickly, again, it will be published next year, so hopefully we can soon promote it as well. I looked at certain elements and described them, how each company could consider health impacts and HIA as a tool within the management systems, and clearly starting with a leadership commitment to managing community impacts, whether it's in the sustainability reports or part of the policy statements, etc. We also describe benefits for the private sector as part of the of that handbook. So I think the we're hoping that again it will motivate other industries as well to look at HIA as a tool. And then again, as I mentioned already, I think lack of legal mandate is a current reality that is going to continue being challenging for companies not wanting to do it. Or doing it as a tick box exercise. But there's an opportunity to position again HIA for companies to be leaders in corporate responsibility and also public health stewardship. There is also inconsistencies in implementation. I already mentioned that financially and just in general, having resources to deliver HIAs is an issue, especially for smaller companies, and also for places potentially, in less developed countries as well. Public and private sector engagement is important, and also it's important also because the innovation that comes from private sector, that's where the data is. That's where the innovation of the actual industry is, but also potentially innovation in how to perform HIAs as well. There might be some innovative ways to do it. So it could be could be less costly and more efficient. And again, in a goal to support sustainable development and health equity. Just very quickly, I think the strengths of this work, that it gave me an opportunity to uh, produce evidence that was not there before. And it was a unique window into HIA practice. Limitation was it was really poor engagement with the companies, but the ones that are participated provided really good information, but it is really limited just to those companies, clearly. And then I had some opportunities to communicate those findings, and I'm going to continue. Again, thank you for the opportunity today. I'm going to continue communicating. And if you can think of any other options to engage and create forums, I'll welcome that. Um, and then the very last thing is, as far as future resource, we do need more case studies to demonstrate what actual difference HIA makes. It would be good to have examples from other industries, outside of extractives, mining and oil and gas. Uh, Application of energy transition projects. There are examples out there, but it would be good to have them as case studies as well, possibly. And then impact on fence line communities. And I just included, I did not look at this community, it was not part of my research, but I included this link to this article of the community in Louisiana that is historically Black, in that suffers from the pollution from the traditional oil and gas activities, has been suffering for years. And now there are carbon capture projects and other energy transition activities in the same communities. And while there are environmental benefits, clear environmental benefits of those projects, I think the health impacts are not being addressed, and the communities are suffering and concerned. So that needs to be looked at. So thank you so much. I hope we're doing okay on time, Oma.
We are doing great on time. You still have about 15 minutes for questions that folks might have for Dr. Subbill. So if you want to raise your hand, type your question in the chat, or even since we are a small group, unmute yourself and ask your question. While we wait for others to formulate their questions, I have a question for you, Delia. You were talking about applying this lens to other industries. Have you seen any evidence that it's been applied, or that industries other than planning and extractive industry are using this as a tool?
Yeah, thanks for the question. When I looked for that evidence as part of my research, and also, as I mentioned, when we were writing the handbook, we really worked hard, tried to find partners, or try to find evidence, so we can expand, and we kind of went back to extractives, because all the examples are from extractives. So the short answer is no, not really. And the only evidence I've come across was from, again, Australia. It was not it was a little bit different, because it was the researchers looking how companies are doing it. So it wasn't from the within the industry either. So it's a little bit different, very limited to Australia. And again, it was just example of McDonald's and another Australian brewing company that I've seen. I hope that answers your question, but
I'd
I
really
think
like
there's potential to definitely continue looking and continue engaging.
I'd love to see it applied to something like those large chicken farms, or cattle operations, right? To have that regularly evaluated, something like that. we have a question from a participant. Go ahead and unmute yourself.
Can you hear me? Thanks. Thank you so much, Dr. Somerville. My name is SOPHIA Webinar. I'm a director of the program called Tracking California within Public Health Institute. A particular term that you use, the outside the fence approach, sort of I find it, very intriguing. We've been working with rural communities and tribal communities across different parts of California. And one of the issues that have come up, particularly in the context of Imperial Valley is, there's been a lot of, proposed, lithium extraction in the Imperial Valley region. And, some of these plants have been set up. Highly extractive industries, with the prospect of, generating billions and billions of dollars with very little attention paid towards immediate and downstream public health impacts, to the communities close by. One of the things that current negotiations between the industry, the manufacturing or the plant itself, along with the county officials and are these sort of community benefit agreements that are being designed, which seem to be the only opportunity for the rural communities potentially to be impacted, to make a stronger case in terms of clauses, shares of benefits, shares of the revenues that the company would generate, as part of these very initial negotiations, so that the communities have an opportunity to sort of safeguard their interest in some ways. And I wonder whether there is a role for HIAs in terms of helping these communities make a stronger case for themselves. And so that's where sort of that outside the fence, approach, seems so relevant. And I wonder whether these sort of community benefit agreements are something that you have come across in your work. This is not something that the industry is basically doing, but negotiations between the industry and the community, and an opportunity for the community to make a stronger case, to highlight potential immediate and downstream, adverse health impacts, and how that can be incorporated into these benefit sharing agreements that are being considered right now. Not sure if I'm sort of framing the question very well for you, but and any reactions that you might have or information.
Yeah, no, thank you for your question. And thank you for describing it as well. It's really, really helpful. Yeah, I'll try to respond. Yeah, and then Dr. Whitehead, if you have any comments, please, on the community aspect specifically. I mean, I would say my short answer is I think yes, HIA can definitely be a great tool to help with some of the community engagement, with some of the stakeholder communication, and also to break down some of the issues, right? Like it's an objective way, it's a comprehensive way to look at all those issues, and then the output, like again with my examples, I don't know if I was clear, but companies really like to have those health management plans to address issues. So and I think the same could be for communities, right? That plan is for the communities. So it could be you mentioned the community benefits agreements, right? So that could be another output as well, just like the health management plans. So I feel like, in my opinion, yes, it could be used. It could be a really good objective tool that can be used. And the output could be the same, different. It probably is similar. It may or may not change the actual project, and that's what I've seen with these companies. But it helps with managing the expectations. It helps with management risks, et cetera, if it's done properly. While it may not be changing the actual project necessarily. So that's just my immediate reaction. I think it's also, I'll make one more point, and then maybe Dr. Whitehead would want to add. I think it could also, ideally, could be a good example of partnership between the private and the public and the academia. And again, we know that again in an ideal world it should work, but in reality there is nervousness on the company side. There is also, they're making a lot of money or hoping to make a lot of money, so they want to do everything fast. They can't wait for researchers to produce their documents in like 6 months. They want it now, but there might be ways to do it faster. And then again, for communities, if it's done properly, again, it could be more reassuring if the academia is there, if the public sector is there, not just the private, because the trust issue, I think, can be also addressed. So it could really be a good example of that collaboration and that partnership.
Yeah, I think that's right, Delia. And I have really seen HIA be very community centered and be that platform for the community, not just to surface their concerns, but to have a seat at the table as a co-equal partner. I have seen it be used as a way for communities to be empowered, and these health management plans. In HIA, we call it an evaluation and monitoring plan. I like to call it a community action plan whenever I do them, because it is not just empower the community to take charge and to look at the data periodically, but it's also describes actions that they can take to hold the whoever the decision maker is, whether that's the local, state, or federal government, accountable for the health impacts. Is be like, see, you knew about this ahead of time. We had this HIA, and AI can be used, Delia, to do it faster. I think that would alleviate some of those concerns. But I also think that it is an accountability tool for communities. And if it's, like you said, if it's done right, it can be very impactful for government too, as a way outside of those community benefit agreements to legally hold them responsible.
Thank you.
Hope that was helpful. Thank you for that opportunity to chime in, Delia. I'm wondering if there are other questions from the audience or from folks online. I would like to ask another question since we have 5 more minutes. I'll take a point of moderator's privilege. What do you think the next steps are? Do you think that this handbook that you were using, and I know that there's the IA handbook coming out in the spring now, but are there other resources that industry uses for HIA, or like toolkits that practitioners inside industry use that might not be available to regular practitioners?
Yeah, that's it. That's a good question. So, I actually, that was one of my questions as well, right? In terms of communication. So, the key for me was to make sure that the findings are used, right, to improve the process. So working with the industry association is definitely on the list, and it still continues, and I'm hoping I can do more going forward. Then we have the professional groups like SOPHIA, like IIA. I think we're doing a lot there. But I think the question is there anything else that we're missing? And are there any other industry groups within the energy, related again to newer energy, projects, development projects and things like that we could do more. I mean, I have thought about it. I haven't taken any specific actions, but there are other industry groups. So that would be definitely something to look into. And then outside of this industry, yeah, there are again probably some, that industry groups that it would be useful to have a discussion, to have a dialogue. Yeah. But in terms of the tools, I would say, well, this is probably it. And there's usually companies would also either have access to consultants or they use consultants for this kind of work as well. So that's another way in, of course, too. So I hope that answers your question.
Yes, thank you.
But if anybody can think of any other forums, I think that would be good to discuss now or at some other point in the future.
So too. I'm not seeing other questions from the audience. Going once, going twice. All right. And with that, then I will thank Dr. Delia Somerville. Thank you so much for sharing your research with us. I found it super intriguing, and I hope to learn more as things develop and as you work with the industry to see about changing the processes. Thank you so much for joining us today. And folks, if you want to come to more great webinars like this, please join Sophia at hiasociety.org, which is in the chat. And we don't have any more events planned for this calendar year, but in the new year, be on the lookout. We will be beginning to advertise our in-person practitioner workshop, which will take place in April of next year. So thanks so much for coming, everyone. And thanks, Delia, again.